Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Welcome to Brainthropology. I am your host, Jessica Smith, and today I am joined by two amazing speech language pathologists, Sue Tucker and Annie Lauria. Today we will discuss therapy and strategies for someone with memory issues and cognitive challenges. My guests today are both speech language pathologists. If you are surprised that speech therapists are cognitive training experts, then you're not alone. Today, we will learn from these two amazing therapists how they can help people after a brain injury, after a stroke. They can help people with memory issues, and people with executive functioning challenges. Here at Brainthropology, we always like to start each day with a positive. So, Sue, I'll ask you your positive for today.
My positive today is my yoga practice. So once a week I go to yoga and I get myself kind of balanced and grounded and meditate a bit.
Awesome. Yes, exercise is good for us all. And Annie, your positive for today?
My positive today is my two adorable little kittens that my family just adopted 2 months ago, and they bring so much joy and liveliness to our house.
Aw, so fun. Kittens are adorable. My positive today, just comfy blankets, like those cozy, comfy, oversized blankets, like cuddling on the couch, and I feel like that'll be good to do this weekend, so that's my positive. So, Sue, can you tell us a little bit about your training, your degree, and a little bit about you?
Sure. So I have a master's degree from Eastern Michigan University, and then I went on to complete a 9-month fellowship, which is what we speech pathologists have to do to gain what we call our C's, which is a Certificate of Clinical Competence. I've worked for 33 years treating adults with neurological issues relating to communication. And I have a couple of certifications. I have one in LSVT Loud, which is Lee Silverman Voice Therapy. It's used mostly with people who have Parkinson's disease to help them counteract some of the effects of Parkinson's disease. And then I also have a certification in a program called the McNeil Dysphagia Therapy Program. And that works with folks who are having swallowing issues. And I've had really excellent success seeing people move from being fed through a tube in their belly called a PEG tube to being able to eat independently. So that's really an exciting one for me.
Wow, that's a lot. You guys put a lot of effort into becoming speech therapists. It's no easy task, but we are so grateful for you. What do you love about being a speech language pathologist?
I love collaborating with my clients to help them meet their personal goals. For some people, that's being able to communicate more effectively verbally. Some people need to manage their own schedules a little more easily. Other people want to return to reading a novel. So every single person that comes into my office has a different goal, and we work together to help them achieve that goal.
Wow, such client-centered therapy. I love it. And Annie, can you tell us a little bit about your training, degree, and experience as well?
Sure. I have a master's degree in speech pathology from the University of Iowa, and I am going into my 25th year of working with adults with acquired neurologic cognitive communicative disorders. I have extensive experience with developing and implementing intensive comprehensive aphasia programs, and I just completed my Lee Silverman voice treatment certification.
You two are so impressive. And what do you love about being a speech language pathologist, Annie?
I really love that I can bring my clients and their care partners hope. I feel like so many of our clients come to us so well aware of what they're not able to do and what's difficult for them. And I really try to make sure that they leave feeling empowered and more cognizant of what they really can do. And then, taking those strengths and using those to try to improve those areas where they're having difficulty. So I love that feeling of being able to empower and give hope and, really work on improving quality of life.
I can say that you both do that. I am lucky enough to work alongside of these two amazing therapists, and you guys do amazing work with our clients. We share clients, and all of our clients just always love you both. So
Thank you.
Thank you.
Can you explain to us a little bit about what speech therapists do?
So I'll start with working on speech, which is, I think, what most people think speech pathologists do is work on speech. Mm-hmm. So we'll get that out of the way and then deal with some of the other things that we also do. But sometimes when people are having neurological issues, whether that's from a stroke, traumatic brain injury, a neurodegenerative disease like dementia, they may have some difficulty in forming the sounds the same way they did before. Sometimes that's because of weakness, and that is controlled in an area of the brain called the brainstem. And we've talked a little bit, I know that Brainthropology has talked a little bit about neuroanatomy, so it's kind of in the back part of the brain. And when people have weakness, they might slur their speech, or they might have some difficulty just in coordinating the movements just so. And then that disorder is called dysarthria. And then sometimes the area of the brain that's affected is a little bit more in the left frontal area of the brain, and that affects people's ability to sequence the motor movements necessary for speech, and that's called apraxia of speech. And in either one of those cases, we assist with clients being able to communicate more effectively, more clearly. Sometimes it's strategies, it's also some skill building that we do.
So we also work on language. And language can mean helping clients communicate both verbally and non-verbally. And we want our clients to be able to convey not just their needs, but also their ideas, their opinions, their feelings. Some of our clients may have difficulty with understanding instructions or conversation, or have difficulty reading or writing due to their injuries. In adults with acquired communication disorders, this disruption of language is called aphasia, which we get to talk a little bit more about later.
We also work on swallowing disorders, so when muscles are weakened because of neurological issues, or if anatomy has been altered due to cancer in the head and neck, clients can have difficulty swallowing. So our job as speech language pathologists is to help them strengthen the muscles to do the job of swallowing more effectively, more safely for sure. And at times this might mean varying types of food that someone's eating, or providing strategies so that food and liquid can pass more safely through the throat and into the esophagus.
So many awesome things. You also do cognitive therapy, which I know we talked a little bit about. And Annie, you'll go ahead and explain the cognitive therapy piece.
Yeah. Whether we're seeing clients for rehab following stroke, TBI, post-COVID symptoms, or for progressive diseases such as Parkinson's, many of our clients may experience changes in attention, memory, or executive function that interfere with their ability to complete tasks in the home, at work, or in the community. So as speech language pathologists, we work to restore their function through targeted exercises and the development of strategies.
Very good. Thank you, Annie. And executive functioning skills. Sue, what does that mean?
Well, if you've ever listened to the other episodes of the podcast, you've heard this term executive functions. And the skill originates in the frontal lobe, though there are other areas of the brain that also help control executive functions. And these parts of the brain are what coordinate multiple skills that allow us to problem solve, make decisions, initiate, set goals, regulate emotions, self-evaluate. And we need all of these skills every day to get through our day. So speech pathologists will work with our clients to find strategies that help manage day-to-day issues that arise, because this management system might not be working at its best.
Sign me up for speech therapy. I think I need all of this. And then we have, I know you two don't necessarily work in pediatrics or with kids, but my son actually just got a referral for speech therapy. So you speech therapists see kids, and talk a little bit, if you can, about what that might look like in kids, or, language and literacy, anything like that.
Sure. So speech pathologists can intervene with children who have acquired speech and language disorders from things like injuries at birth or injuries from traumatic brain injury. And then they can also have disorders from a developmental issue where they're just not hitting their milestones as typically developing children might.
Yeah, I have to tell a story really quick about my brother. So he was probably like 3. I vividly remember this. We were on the way to my grandma's, and he kept saying something about Boo Barney, and we didn't know what he was talking about. It was shortly after that my parents had signed him up for speech therapy. But he had a cousin that was only a couple months younger than him, and in my family there's things, we called them twin cousins, because we all have a twin cousin. I have a cousin that's 9 days younger than me. He's my twin cousin. But so it's really fun. We come in pairs in cousins.
That's fun.
And his twin cousin knew everything he said. So I remember as a family, we didn't know what my brother would be saying. And he didn't have a specific disorder. He was kind of what you described, just a little bit behind, wasn't hitting those milestones. But we would get on the phone and we'd talk to Caitlin, was her name, and we'd say, okay, tell Caitlin what you want to tell us. And we'd give Caitlin the phone. He'd say his mumble jumble, and then we'd get back on the phone and we're like, okay, Caitlin, translate for us. And she'd say what he told her, and we're like, oh, so is this what you wanted? And he's like, yes. And we never knew if he was just agreeing with her or if she really did understand, but they had some sort of unspoken or spoken language that they just understood each other. So that was kind of a fun story. And
that is a fun story.
He did speech therapy for, I think it was maybe a couple years, and he's, definitely a great functioning adult. Everyone can understand him. And it really was just kind of a, quick thing. And I say quick lightly. I mean, a couple years is a lot of work, but yeah. I don't mean to take that away, but it was a fun, speech therapy story. And
yay for speech pathologists.
Absolutely.
Did you ever find out what Boo Barney meant?
Yeah. So then he specifically called his pillow. It was the first time he referred to this as Boo Barney, but then for years he had a Barney pillow. And it became like his lovey, like he had to carry it everywhere. And so I think he might even still, he would kill me. Oh gosh, I hope he doesn't listen to this one. But yeah, he carried it for years, and it was a Barney pillow, and he used to rub it, and it was like really kind of disgusting by the end of its life.
Oh no.
Yeah. Okay, back to one of the last things on our list for today, and this is not an all-encompassing list because I know speech language pathologists work on so many things, but the last one we have on our list is voice. So Annie, do you want to describe that a little bit and what speech language pathologists work on?
Sure. We work with clients with a variety of voice disorders related to vocal fold trauma, decreased loudness that might be due to Parkinson's or aging, or vocal fold paralysis, and we try to help clients achieve a healthy functional voice for the context in which they want to communicate.
So can you tell us a little bit about the type of people that you work with, and specifically at where you both work, Galaxy?
Sure. speech-language pathologists work with individuals across the lifespan, from infancy all the way up to end-of-life care. Here at Galaxy, we specialize in working with older adolescents and adults with acquired cognitive communication disorders. And I'd say the most common diagnoses in the clients that we treat would be stroke, traumatic brain injury, Parkinson's, ADHD, cancer and post-cancer treatment, dementia, and MCI, which is mild cognitive impairment in older adults.
Okay. So do you have to have a specific illness or injury to need services from a speech-language pathologist?
No, sometimes people can experience cognitive changes when they're under acute or prolonged stress, and others might struggle with organizing or getting through their day due to ADHD, for instance. And we can help clients develop strategies in those situations. But I'd say our typical clientele comes to us following medical diagnosis of some sort that involves changes in the brain.
Okay. Today we're focusing on the cognitive part of what you two work on with your clients. Are you able to actually improve memory, or do you just use strategies to help people compensate for memory challenges? Can you walk us through that a little bit?
Sure, and that's really kind of a tricky question, and my answer might not be what you expect. So the first thing we do when somebody comes to us with concerns regarding their memory is assess and treat attention, because attention is really the foundation for your memory. If you're not attending to something, you can't encode it into memory, and you won't be able to retrieve that information for later recall. So the current evidence for memory intervention supports addressing any attention deficits and developing functional strategies to help people recall the things that are important to them. That might be remembering names of friends at a book group, or being able to run several errands without forgetting to do one of them, baking a cake without leaving out an ingredient, or remembering to take your medications as prescribed.
That makes a lot of sense.
Yeah. When clients come to us with reports of cognitive issues, we also provide a lot of education, particularly about brain healthy behaviors. So those can include physical fitness, being socially active, increasing mentally stimulating and challenging activities, helping them with sleep management and rest, and also encouraging them to follow any medical recommendations that their physician has prescribed, such as managing their diabetes, high blood pressure, things like that. So I think we're going to put in the show notes a document that we often use for that the Cleveland Clinic put out, that we really think is well done, well organized. I guess I'll also add here that one of those items that I talked about, physical fitness, there is so much evidence right now about the benefits of physical fitness. So sometimes we work, when we're developing sort of plans of action with our clients, we'll work with our physical therapists to find out what ways we can maybe increase their activity levels and do that safely, or we would have them also consult with their physician, of course. But there's been a lot of research about the benefits of physical fitness on the hippocampus. And again, kind of going back to some neuroanatomy, the hippocampus is a small structure that's in both hemispheres, and it's deep within the brain, kind of where the temporal lobe is. So if you think about your temples, it's kind of there, but deep inside. And that is where memories are sort of consolidated. So that's where our short-term and long-term memories are sort of processed. And that's also where the visual spatial memory is stored. And some of the studies coming out of a gal named Wendy Suzuki in, I think, New York University. She's a neuroscientist, and other neuroscientists too have found that exercise actually increases the volume of this hippocampus. So new cells are formed just through exercise. So I think it's pretty exciting. And 3-4 days a week, 30 minutes of exercise has been really showing really good improvement in not only improving memory, but also has sort of a neuroprotective effect. So people who have dementia, it can slow the progression of dementia. So I think that's really exciting to share. And
Absolutely.
Exciting and important,
Yes.
definitely.
Yes.
I know we were chatting earlier before we started, and you mentioned a TED Talk that you were potentially also going to include in the show notes. Was that Wendy
Yes.
Suzuki's? I love her TED Talk.
Yes.
She's done a couple, I think, but I think I know which one you're referring to. And
Okay.
that's a great one, and we will definitely add that in the show notes too.
Yeah.
Okay, so what can people actually do to improve memory?
So we try to train our clients to pay attention to important information in a lot of different contexts, just like we have to do in real life. That might mean dividing your attention between listening to a podcast and working on a computer and remembering details from that podcast, as well as that you need to make a phone call in 15 minutes. So we try to create situations that present the client with the same challenges as they might face in everyday life so that we can problem solve and create some workable strategies.
One of the techniques that I really like, and especially with some of my clients who are experiencing mild cognitive impairment or actually the earlier stages of dementia, is a technique called spaced retrieval training. And there's a lot of evidence for its efficacy, and I've seen really great results with it. And basically, it's finding something that someone wants to learn. So I had a client a few months ago that really wanted to have a better idea of what his daily plans were for the day and what was going on, and had a hard time accessing his calendar app on his phone. So I did a training where I would just say, show me how you get into the calendar app on your phone. And he would show me, and then I would wait an interval of a minute, and I'd say, show me where that app is on your phone and get into it for me. And then you keep doubling the interval until you get to 16 minutes. So if a person can hold on to the information that you're teaching him or her for 16 minutes, that memory has basically moved into kind of the storage area from short-term to longer-term memory. And you repeat that whole process for 3 days. And if they can hang on to it for those 3 days, it's kind of there. And it was really exciting to see him make that improvement. And he was able to kind of what we call kind of consolidate or encode that information. And he could then independently access his calendar and know what he was doing from time to time.
Wow, very interesting. And in those periods of time where it goes from 1 minute to 2 minutes up to the 16 minutes, are you doing something in between? So it's almost like they're distracted and then they have to come back to it,
yes,
right?
Exactly. So we'll have something, usually I'll try to pick something that's somewhat simple, that's not too challenging for them, but that keeps them sort of busy and is easy to kind of interrupt.
Yeah.
And I think what's most important is that I'm training the caregiver or the care partner to use that technique. So I'm modeling that for them so that they can use that in situations at home that, sometimes some of the behaviors that people who have dementia exhibit can be really challenging for the care partner. And so any kinds of situations where we can help, we want to do that for the care partner too.
Absolutely.
Yeah. I think we would all love to have improved memory. Do you have an exercise that you could recommend for our listeners to try at home just to kind of feel what it might be like to do some of these exercises to improve memory?
One complaint that's been shared with several of my clients is that they can't remember to get all of their errands run. So they might start running errands and miss a whole errand and get home and then realize they've got to go back out, and that can frustrate them. So I've had really good success with having them just, first of all, write down each of the places that they want to go and just have it like on a sticky note and keep it somewhere somewhat visible for them in the car, like maybe on the dashboard. And then when they get into the car, I ask them to simply visualize their route from point A to point B and get from point A to point B. And then when they get from point, B to C, they're going to do that same thing and visualize. One of the particular clients that I worked with was having some disorientation while she was driving, and this technique completely alleviated that. And she was really happy to not be in the middle of driving somewhere and feel like she was lost or disoriented. So
I'm the sticky note queen, and I actually do that with my errands. Like, I write down, and then I have to write down what I need to get from the store. So I use a lot of strategies myself. I've never done the visualization, though. I love that, and I'm going to try that.
Yeah, it's kind of pairing the external strategy of writing it down, but also that internal part. So that's been really successful for some of my clients.
Earlier, you mentioned memory strategies that you can develop with clients. What are some of those strategies?
So strategies can be internal or external. Internal strategies are things such as repeating the thing that you want to remember to yourself over and over again. So say I need to get pasta and lentil beans from my pantry, and I'm walking to the pantry and I'm saying pasta, lentil beans, pasta, lentil beans, pasta, lentil beans. And visualization, such as Sue discussed in her earlier example. And most people do things like this without even realizing that they're using a memory strategy.
It's so funny. My 4-year-old does this. So he wants to remember something, and I'll just like hear him and see him repeating it. So it's like it's almost intuitive to do some of these things. Like, and it's like just so cute that he came up with it. I never told him to do that. He just kind of came up with it. Like, I really want to remember this, so I repeat it.
I love that.
Yeah.
And I think that's so important that we realize that everybody uses strategies, because I think a lot of the people that come to us feel, there's a lot of shame or embarrassment about their difficulties with memory, especially. And just for them to realize, hey, you've probably been using strategies your whole life. And you didn't even think about it. And I use strategies every day. Like, I'm writing notes on our session, because if I don't write them down, I'm going to forget what we talked about.
Right.
So there's those internal strategies. And then there's external strategies. And those are things such as paper and electronic calendars and planners, alarms and timers. And there are a lot of great apps, such as MediSafe, which is a medication management app that a lot of our clients use. And it can really be a game changer for getting them to take their medications when they're supposed to. And increasing their independence with that as well, because I think, so many of our clients really struggle with that independence piece and that feeling like they're less than adult because they need more help to do things. So using these kind of external strategies can really increase their confidence. I also really like the Day One app for recording day-to-day activities. People can make notes about what they did. They can take pictures of where they've been and who they've seen. So that can be a really nice one. And I absolutely love Google Keep for list making. I know Sue also likes Todoist for daily to-do lists.
I do. I use it myself.
I know. And I am a big Google Keep fan. So I feel like no one escapes my clutches without hearing about Google Keep. And these are, just like we talked about earlier, these are strategies that even people without any diagnosed memory disorder use every day, myself included.
Yeah, I love Google Keep too, and I love the search feature, but I haven't heard of Todoist, so I'm going to have to check that one out.
I like Todoist because you can color code your to-do list. So there are things that I put on there that I want to do for work, and I color code them a certain color, and then things that I want to do, make calls, those are a different color. And what I like better than anything is that I can move them very easily, because there are lots of things on my to-do list that I don't get to because, as we know, we need to prioritize, and some days we just don't have the energy to do everything on our to-do list. And I am perfectly fine with, I've got something on my to-do list right now that has been on for a couple months, and it's just something I know eventually I want to do, but I don't have to do it today, tomorrow, even next week, but I just keep kind of moving it along, and eventually it will get done.
Yes. Yes.
Jess, I wonder if you like Google Keep, because I describe it as sticky notes for your phone.
Yes. Yes, I do. And I use them just like sticky notes for my phone. So yeah, there's a lot of features about Google Keep. I really do like that you can search too, because I know one word that I'm looking for, and it's like, oh, if I can just get that word out, it'll find it for me. So,
Right.
Yeah. So do you guys have any examples of a success story of one of your clients using certain strategies?
I have one that was kind of a little bit more unique. So I had a client who would get a text from his wife asking him to pick up maybe 4 or 5 items from the grocery store. And even though it was written down for him in a text, he would get home and find that he didn't have 1 or 2 of the items, and he was baffled by it. How can it's written down? So I have a great grocery store app that's shareable that I recommend to people. It's called Our Groceries, so I'll throw that out there because I really love it. It can sync to multiple people, so my husband and I both have that app on our phone, and when we open it up, we can both see the grocery list, and whoever's at the grocery store can get everything on the list. But he didn't want to use that app, so we had to think outside the box a little bit. So I taught him how to copy the text that he was sent and put it into a text box so that it was kind of an open text. And then when he picked up each item, he would erase it off of that little text box. And once the text box was empty, he had all his items and he didn't have to return back to the grocery store. So that worked really well for him. He used it. He probably still, I hope he still uses it, unless he, doesn't need it anymore. But
yeah, I actually do that at the grocery store too. I have to delete things. Otherwise it gets visually overwhelming for me. I don't know. It's just, I have to go through. So I use Google Keep and make my list and then delete it. And I know talking about all of these apps might feel a little overwhelming if you're just listening, but we will make sure to put all of these app names in the show notes so that those are all there. So anyone doesn't have to feel like they have to jot things down, and a memory strategy will be, don't worry, they'll be listed in the show notes so you can refer back to that. So for people out there listening who might have memory problems or love someone with a memory problem, what are the first strategies that you would suggest they could try on their own?
I would say to present information in multiple ways. Some people have better visual memories, so memories for what they see. Some people have better verbal memories for what they hear. But almost everybody does better if they get information presented in more than one modality. So, for example, don't just tell your spouse that you have dinner plans tomorrow night. Write it on the calendar. Or some other designated space for information sharing. That might be, a whiteboard for some people. It could be a paper calendar. It could be a shared electronic calendar. If there are tasks that you'd like your spouse to complete, talk about it, then write it on the whiteboard. A lot of care partners that I meet are, they say, oh, they just ask the same question over and over and over again, and 5 minutes, go by and they ask the same question. So if repetitive question asking is an issue, write that information and refer your loved one to where they can find the answer they need. So get in that habit. Instead of repeating that answer over and over again, empower that person by either writing that for them or having them document it in that space that's designated, and just saying, oh, remember, it's right there on the whiteboard. And I think for many people, they'll get used to looking for that information there on their own. And it's just so empowering for people to be able to know that they can find the answers they need on their own without asking their loved one over and over again.
Yeah, and I think it's important to note, it really should be that person picking what works for them. For me, I like paper pencil for certain things. I think there's just a way that I encode things better if I'm writing it down versus typing it for certain things. So for me, it might be I want it written in a paper planner versus on an electronic calendar, you know? And I think it's just making sure it's that loved one that's picking where that information is, because we know as therapists, if they're picking that spot, then it's likely where their brain is going to go. So I think that's also a good point.
That's a really good point. And I think we do a lot of that in therapy is make some suggestions. How does this sound? We collaborate together. Let's try this and see how it works. They say, they come back, they say, well, I don't know, that wasn't really it. And we just play until we can find something that really fits their lifestyle and their best mode of accepting the information. So,
and I think that I always describe strategies as having a bag of tricks, and it's great to have a great big bag of tricks. And certainly between Sue and myself, we have a big bag of tricks. But not every trick that I show you is going to work for you. And so it's really important that we get that feedback about, no, that wasn't quite right. Or, yeah, I really like that. And I think this could work for this too. So it's really depends a lot on that dialogue between the clients and the therapist.
I find as a therapist, I typically give the trick or, pull out of my bag of tricks, give it to a client, and then the client fine tunes it, right? Yeah. They're the one that well, this piece worked, but I'm going to change it a little bit. And I love when I get that feedback, because then they're fine tuning, I know and remember for the next client. And then I can say, you know what, this client gave me this feedback about this particular strategy. Yeah. Why don't you try it this way? And, so anyways, it's just always, I tell my clients all the time, you guys are the masters, share your knowledge with me so that I can pass it on. I really just collect from my clients and then pass it on. So
yes, I agree. I don't think I've ever had a client in all my 33 years now that I haven't learned something from, whether it's professionally or personally. It's fascinating that way. It really is.
Yeah. So I take strategies from clients and implement them for myself. So we're just strategy sharers.
Well, that's how I got the Our Groceries app. Is that one of my clients told me about it, and I'm like, that's amazing. And I started using it, and now I disseminate that information to anyone who will listen.
Absolutely.
Same story for me for the Google Keep app.
Yeah. Yeah. It's our clients that really we owe it to. So Sue, if you could give one piece of advice to someone who has concerns about their memory, what would it be?
I just want them to know that there's hope out there. Like Annie had said, there's quite a bit that can be done to improve a person's cognitive skills and memory. There are brain healthy behaviors that can improve function and actually have been shown to slow progression of disease processes. I think that's really, really important. So if a person is experiencing mild cognitive impairment, or sometimes it's called neurocognitive disorder, come early and start using strategies. Learn as much as you can about things that you can do to sort of either slow the progression or turn around those mild difficulties that you're having. And coming to see speech language pathologists or occupational therapists can really help people improve in some of those areas and alleviate some of the frustration that can come and some of the stress that can come from knowing that you're not functioning where maybe you used to function.
Yeah. Sometimes it's so easy to avoid that or kind of want to ignore it when you start to realize that. But what I heard you say is, acknowledge it and come get those strategies. Come to us so that we can share those strategies, because you can actually slow it, yes. Slow the progression and slow that. So be vulnerable and come get the help, because it really can make a difference.
Right.
Yes. Thank you, Sue.
You're welcome.
Annie, if you could give one piece of advice to someone who loves or cares for someone who has memory problems, what would it be?
So I would say be patient and resist the temptation to say, we already talked about that, or I already told you that. We had talked about how so many of the people we see with memory loss really feel shame and embarrassment about that. And this just increases the frustration and stress for both that person with the memory loss and for you as a care partner. And then when you have that frustration and stress, that doesn't do anything to help memory at all either. So just be patient and encouraging, and try to remind them that nobody remembers everything. Yeah. It's okay. It's okay not to remember some things.
I want to thank you both for being here. We've learned so much from you, and we can't thank you enough for joining us today. Your amazing knowledge and experience has been great, and I know our listeners appreciate it as well. So I want to extend that thank you. Thank you to our listeners. And in closing, I want to end with be courageous and move forward in your day with hope, joy, and purpose. While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever-changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.